Professor, first of all, maybe kindly introduce yourself, who we're speaking to, your title, then give us a short explanation about this project which is starting here in East Africa.
I am Professor Nigel Lightfoot. I'm the Executive Director of Connecting Organisations for Regional Disease Surveillance, known as CORDS. This project began some years ago with ideas from the local people here in Southern Africa Centre for Infectious Disease Surveillance, which is based at Morogoro University, Sokoine University. And they believe that the earliest information about something beginning to happen in a community comes from the community itself. And that's very true. All of us know that outbreaks, events, incidents always start somewhere and very little signals to begin with. But the earlier you find out that something has changed, something is happening, the easier it is to work out what is happening, make an intervention, and reduce the impact on the vulnerable populations, the children, the villagers. This is what never happened in West Africa with the Ebola outbreak. The first case was at the end of December. A small child died of Ebola hemorrhagic fever at the end of December. And then it wasn't noticed by the world until a newspaper, Africa Guinea, reported that people were dying of a strange illness in Macenta. And that was on March the 17th. So that's nearly 3 months between the first cases and something recognizing that it was happening. Now, in Southern Africa and East Africa, the countries here have been working together. And that makes a lot of sense, because when countries work together, they help each other, it costs less, and they get there faster in their preparations. And because they work together, they build trust, and they actually know each other. So should something happen in one of the countries in Southern Africa or East Africa, the other countries are there to help almost immediately. So it presents a different picture. Now, this project goes one step further, and it's about people in the community, the local health workers, the local animal health workers, the community leaders, being able to use mobile phones to send information to a central computer where it's analysed and reported back. And the important aspect of that is that it's reported back to the villagers and the people so they can make their own decisions about what to do. But if you have this happening, then it's going to be much faster than any other system. And to me, it's very important. The other aspect of this is it's been created by Africans in Africa for Africans. All we do is enable them and help them to do it and try and find the funding to make sure it's pushed along. And so we've got funding from the Bill and Melinda Gates Foundation and funding from the Skoll Global Threats Fund to make this work. Now, one of the things they did in December last year was to get information technology software experts together with health experts to work out how do we get this right, how do we make it work. And they've done it. And again, that was funded by Skoll Global Threats through CORDS, of course. Now, the interesting thing is this is going to be beginning in a cross-border area, Ngorongoro and Manok in Kenya. And there, the people cross the border all the time. It's not really a border as such, as we would think of it, but as you know, it's happening all the time. People cross, animals cross, grazing animals cross. And so there's a complete intermixing of things across the border. So it means Kenya and Tanzania have to work together. And this project will begin it. Now, we're going to make this project go even further, go all the way down the Rift Valley between Burundi, Tanzania, and Zambia and other countries. So it will become important. And when I talk to the people here from Zambia, they say they want to get started straight away. So I think when people know what these people are trying to do, these experts are trying to do, then lots of other people will also want the same tools, the same things, and the same things for their people. And then finally, just to say that this depends on the people in the community, or the people who notice things. Did some animals die? Are more children sick this morning than we expected? And then that starts something happening, did it? And so it's about people in the community, and I believe that's where it really belongs, it lives, and it's theirs, and it will help them.
We have seen this is the second phase of the project, and it's about to start running. Maybe so far with the stage which this project has reached, are you satisfied with the stage the project has reached so far right now?
Yes, the earlier project, which was funded by the Rockefeller Foundation, the report was glowing and said this must be scaled up. It works. And we saw in that part of the project how SACIDS and eAIDSnet had trained people in communities and got them working with mobile phones. So this is just moving on from that. I expect this to move on faster and faster.
And when it comes to maybe so far the challenge to now, have you noticed any challenge on this project or not yet?
There are always challenges in all projects. And the important thing is to be flexible and adaptable. And it's important that the people in government know that it's happening, because you can get political blocks for things happening. It's been developed by the people themselves, and I think that the other potential block is that the people in the community say, oh, we don't want this, we don't like it. So that means work has to be done with them, talking with them about how it's going to help them, how it's going to work, so that it becomes theirs rather than something forced onto them. And I think those processes, government and the local people, are two key important steps to make the project successful.
But the issue of there's a big challenge when it comes to the technology of some of the places when it comes to coverage. Maybe don't you think in one way or another hinder the project, like in terms of coverage and something like that?
Coverage in Africa, both for mobile phones and for the internet, is improving day by day. And I think we shouldn't see it as a block to the development of this project. There will be times when mobile phone network is down, but it can be stored on the mobile phone until you're in a place where it's up and running again and go. In fact, the tool will work and store the data and send it when it's convenient, if you're out of range, for instance. So I don't think that is a block to it working.
You said earlier that this is the second phase of the project, which is about to happen. Maybe what's the next step now from here?
Well, it's very interesting, because I think it's so attractive and so helpful that other people are going to want it, other countries are going to want it. So if your radio station publicises this, there'll probably be questions about how do we get a hold of this, how do we do it? And the important thing is all of this is owned by the people. It's not company owned, so it's easily transferable. And then, interestingly, we're working in West Africa post-Ebola, and we want to take the people here to the countries in West Africa just to show them what can be done with just simple approaches and simple tools and working with the communities. So we'll be taking them all to talk to the West African countries and help the West African countries get in a better position.
Professor, you said that you also work in the West African countries, which are among the countries which are highly affected by Ebola. And looking at this project, you have sponsored the project in West Africa, and here you are sponsoring here in East and Southern Africa. Do you see any light for the country of East Africa in trying to protect against Ebola compared to the West African countries?
I think the East African countries are really well prepared. And you look at the East African community and eAIDSnet, and you see that they all help each other and have sent many people to West Africa to help with the Ebola outbreak. These countries work together and are willing to help each other. And that's what makes a big difference. So I don't think there's a risk or an increased risk of Ebola or Marburg or any other infection in these countries in the East Africa. I think the countries are well prepared, and we know from the work we've done with them that they have a good system of operating to identify outbreaks and deal with them rapidly. In West Africa, that wasn't there. And I think we can help from Southern Africa, East Africa, to the West African countries be in a better position to fight the next problem, the next public health problem that comes their way.
Just to wind up our interview for today, maybe what message do you have to our listener in East and Central Africa who are listening to this program right now, and Africa in general?
I'm really impressed now, talking to a lot of people around the world about the way we can help Africa solve its own issues and problems by working closely with the people and working with communities. Communities are the key to all of this, and I think it's noticing that and then talking to other people who say, yeah, we want to put money into Africa for the Africans to use themselves, working with scientists, experts, private industry to solve their own problems. I think this is a good way forward.
Just one tricky question I would like to ask you, but you tell me if you're willing to answer or not. Are you funding this project in East Africa and Southern Africa? There's a challenge in some of the countries whereby most of the funds have been misused. Maybe do you think in the future something like that can come out in East Africa, or you think the money of the donor is well used?
I think you will hear many criticisms of money being misused across a lot of African countries. And we've been aware of it being reported in West African countries responding to Ebola, into other countries. I've not been aware of it in East African countries or in Southern African countries. And the fact that the countries are working together in a network almost creates what we call a peer review process. Like some money is being given, is it being used properly? Then somebody will say something if it's not being used properly. So I have every confidence in East Africa and Southern Africa that the funding will be used properly.
Thank you very much, sir. It was a pleasure having you in our interview here at RFI Kiswahili.
Thank you very much. I'm sorry I can't speak Swahili.